Hello, people in the audience, my colleagues, the faculty of ESH. I'm really sorry not to be with you. And I hope that you still can enjoy our research. You know, our research, these are my disclosures. You know, as a physician scientist, our research always starts with patients. We study problems that are depicted by patients. We take it to the lab, and then we make discoveries that hopefully can be translated back to patients. And this is the story that I want to tell you today. But before telling the leukemia story, I want to tell you another story. This is a very special patient. This is my late father who died 30 years ago from brain metastasis of lung cancer. But I don't want to talk about his disease. I want to tell you that 82 years ago, my father, who lived in Poland at that time, saw German SS soldiers bursting to his home and killing his parents and two siblings. He, at that time, was an adolescent, and he managed to hide, but he saw all this slaughter, and all his life suffered post-trauma, and we also suffered because of it. I never imagined what happened 4 weeks ago, Saturday, 4 weeks ago, when I woke up at 6:30 in the morning to an horrendous event that was so similar to what my father undergone. But instead of German SS soldiers, there were thousands of Hamas terrorists, Hamas SS, that broke into the homes, hundreds of homes of civilians near the Gaza border. And I want to tell you that we know now that 21 children underwent exactly the same experience as my father. Saw their parents and their sibling murdered by these terrorists. But they were actually lucky, because more than other hundreds children were either our massacres, their heads were decapitated, they were mutilated or burnt alive. And there were some luckier children, about 30 children that were kidnapped to the Gaza Strip. But today, when I talk to you, we are in a different situation. This is not the Holocaust. It's an Holocaust-like event, but this is not the Holocaust. We have a state, we have an army. Our family was involved in this horrendous event that I tell you about. But our son, 35-year-old son, is now mobilized to the army. And he and his friends will make sure that those criminals will be brought to justice and will pay for their crimes. And what frustrates me, and is common to all of you sitting here in this audience room, and to the faculty member, to every one of us, that we devote our life for the cure of leukemia, a rare, devastating disease. And if you only knew how many children and adults from Gaza and from other Arab countries we have been treating for leukemia. And we have to tell you they had to record this talk twice, because it was interrupted by an alarm in my community, which is between Tel Aviv to Jerusalem. The alarm is because of missiles that are flown from Gaza, and this sand sculpture made by this Margaret Ayres is a very painful reminder for the memory of the victims that were murdered on October 7, 2023. And this final slide is an advertisement for our lab. Peace will come back to Israel, I'm sure, within the next few months. And it's wonderful to be in our laboratory and to be in Israel and ask the many postdocs that we had from abroad. Thank you very much.